Let's talk about cluster headache. What are the clinical features and how to treat cluster headache? First, starting with clinical feature. Cluster headache, cluster. What it means? It means the patient will have few episodes of headache for a few weeks and then he will be alright for months to years, when he will have again another episode or another period or few weeks where he will have headaches every day, almost every day. So those are the clusters. The headaches will occur, and when they occur for a few days to weeks, and then they stop for a few months to years, and they happen again in a cluster, in a group. So that is the naming, the cluster headache. What's the headache? The headache is usually unilateral, and this is very severe, and it's mostly around the eyes. Unilateral severe headache around the eyes. What's the duration? Classically this lasts around 60 minutes, but the range is from 30 to 90 minutes. But classically this is 60 minutes. The pain usually starts at night, waking up the patients. That's why the pain is also known as an alarm clock headache. And in a single 24-hour period, a patient may have multiple cluster headache episodes. What are the associated features? You can see the eye. There are multiple features in the eye because the headache is around the eye. So you can have lacrimation. The eye may become red, conjunctival injection or red eye, and sometimes the patient may have features of Horner syndrome, which is ptosis, miosis, anhidrosis, and anophthalmos. During the headache, the patient is severely agitated. Compared to migraine, the migraine patients want to rest, but the patient with cluster headache are severely agitated. Now, how to treat? The treatment for acute headache is sumatriptan, usually given in subcutaneous route. Sumatriptan given in subcutaneous route. Another option is giving oxygen, which is 100% oxygen. So those two methods, each one of those has a very good efficacy. In patients with debilitating cluster not responding to the above treatment, we can give lithium therapy, and obviously this will require monitoring. In some patients, we may have to give prophylaxis, and this is usually done by the VVS. What is VVS? V for valproate, another V for verapamil, which is the calcium channel blocker. So those two are kind of similar, like migraine. They are also used as prophylaxis in migraine. So they work not only in migraine but also in cluster headache. We can also use steroids for short term. And just like migraine, we have to avoid the triggers. The triggers are different. Here the triggers are smoking and alcohol. So avoid smoking, avoid drinks such as alcohol. So that's all for cluster headache. Thanks all for watching. Please do like and subscribe to my channel.